Thank you so much for such a warm welcome. No wonder my Maine folks are all getting up to wave in the back. No wonder I so look forward to your visit every year. It's really splendid and a great opportunity to welcome you back to Washington. This year, we gather at a particularly difficult time, a time of huge and soaring budget deficits, and yet a time when the number of seniors in our country is growing exponentially, seniors who are going to need the kind of skilled home health and hospice care that you excel at providing. So we have our work cut out for us, but as I look around this room, and as I learn more and more about what you do, I am convinced that we can make the case that home health care not only is the most compassionate care, it's the most cost-effective care as well. So issues affecting home care and hospice have been at the top of my priority list ever since I came to the Senate. And it's been my pleasure to work with Val and his talented team and my friends from Maine on a variety of initiatives to modernize and promote fairness in the Medicare home health and hospice benefit. The highly skilled services and compassionate care that you provide has helped to keep families together, and it's enabled millions of our most frail and vulnerable elderly people to receive care just where they want to be, not in a nursing home, not in a hospital, although sometimes those clearly are necessary, but rather in the comfort, the security, and the privacy of their very own home. In fact, a survey conducted last year for the Maine chapter of AARP found that 9 out of 10 Mainers would prefer to receive services at home as opposed to in a nursing home or other residential care facility. That doesn't surprise me at all. And although this survey was taken in Maine, I am positive it would be replicated across this great country. Moreover, by helping these individuals avoid more costly institutional care, you are saving Medicare billions of dollars each year. And that's why I find it so ironic, actually ironic understates that I find it so disturbing that the Medicare home health and hospice benefit continually comes under attack. The healthcare reform bill signed into law by the president last year includes $40 billion in cuts to home care over 10 years. Moreover, these cuts are a double whammy, as my friends from Maine would describe it, because they come on top of $25 billion in cuts over the next 10 years that have been opposed not by Congress, but by the Centers for Medicare and Medicaid Services through regulation. The administrative payment cuts imposed by CMS are based on the assertion that home health agencies have intentionally gamed the system by claiming that their patients have conditions of higher clinical severity than they actually have in order to receive higher Medicare payments. This unfounded allegation of case mix creep is based on what CMS contends to be an increase in the average clinical assessment score of home health patients over the last few years. Well, you all know what the facts are. The facts are that there are very real clinical and policy explanations for why the average severity of home health patients' health conditions have increased. For example, the incentives built into the hospital DRG payment system have led to the faster discharge of sicker patients. Remember sicker quicker? That's what this is about. Advances in technology and changes in medical practice have also allowed home health agencies to treat more complicated medical conditions that earlier could only be treated in hospitals or nursing homes. My friends, that's progress, that they can be treated at home now. And of course, that's going to mean that it's more expensive than it used to be because those individuals used to be in either hospitals or nursing homes. So what troubles me most about these unfair payment cuts is that they're being assessed across the board, even for home health agencies that have showed a decrease in their clinical assessment scores. My view is that an individual home health agency truly is gaming the system, then CMS ought to go after that individual agency. It's simply not fair. It's not right to penalize everyone. The research methods and data that CMS has used to justify the payment cuts also raise serious concerns about their validity. Moreover, the process CMS has used to evaluate changes in case mix coding has not been transparent. I defy anyone to try to figure it out. And it has not allowed for true participation on the part of home healthcare professionals and other stakeholders. If this needs to be done, tell us why. Explain it. Show the methodology. Prove the case. None of that has been done. So later today, I will be joining my colleague from Washington State, Senator Maria Campwell, in introducing the Home Healthcare Access Protection Act of 2011. It will establish a reliable and transparent process for determining whether Medicare payment rate cuts are needed to account for improper changes in case mix scoring. Our legislation would also prevent the imposition of future payment rate cuts until the Secretary of Health and Human Services is able to justify those cuts through an improved process set forth in the bill. And you know how it is when two women, a Democrat and a Republican, team up together. It's a hard force to stop. The fact is that additional cuts deep cuts in spending for home health and hospice care are completely counterproductive to our efforts to control overall healthcare costs. It takes us in exactly the opposite direction. It was also mentioned that I've introduced another bill, and that is to allow nurse practitioners to sign off to order home health care. You know, I come from a large rural state, and there are many communities where a nurse practitioner may be the only source of convenient care, requiring him or her to wait to get a doctor to sign off on home health care delays needed services to our seniors. And if one of our goals is to prevent unnecessary hospital readmissions, we need to do a lot better job on that transition to home, and home health care is absolutely essential to achieving that goal. So I'm going to close with a challenge for you today. As you make your Hill visits, first of all, educate your members of Congress about why home health care is the cost-effective, compassionate alternative. Tell them if they want to reduce health care costs, you have the answer. Explain the difference that you're making in the lives of your patients and clients and their families. Urge them to co-sponsor the two bills that I've mentioned and push them a little bit. Ask them to get back to you with an answer. Don't settle for, well, we'll take a look at it. That's what they'll say. And that's legitimate and fine. But then say, well, after you've done so, let me know what you decide, so that you hold their feet to the fire a bit. And my most important advice to you is to invite them to go with you on a home health care visit. As Val knows, as my friends from Maine know, that's what made me such a committed advocate. When I saw firsthand the difference that your services were making for my constituents, I knew I had to become your advocate. Because the fact is that you're the true champions, the true heroes who are out there on the front lines every day, who at times are driving enormous distances to provide care for an elderly couple living in the backwoods of the state of Maine. And you help make it possible for them to stay together in the golden years of their lives and to not have to leave what well may be the only home they've ever known. So your work is so important. You have a wonderful team in Val here in Washington, but they would be the first to tell you that they can't do it alone. They need your help. Together, we can make a difference. Thank you. Thank you, Val.